Greetings from St. James Baptist Church in Durham, North Carolina. I'm Susie Searles, RN Parish Nurse, and I'll be presenting a mental health talk today. About mental health. Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress related to others and make healthy choices. Mental health is important at every stage of life, from childhood, adolescence, through adulthood. Although the terms are used interchangeably, poor mental health and mental illnesses are not the same. A person can experience poor mental health and not be diagnosed with a mental illness. Likewise, a person can have a diagnosis of mental illness and experience period of physical, mental, and social well-being. Our mental health is important to our overall health. Mental and physical health are equally important components of overall health. For example, depression increases the risk for many types of physical health problems, particularly long-lasting conditions like diabetes, heart disease, stroke, and similarly, the presence of chronic conditions can increase risk for mental illness. Mental illnesses are among the most common health conditions in the United States. More than 50% will be diagnosed with mental illnesses or disorders at some point in their lifetime. 1 in 5 Americans will experience a mental illness in a given year. 1 in 5 children, either currently or at some point during their life, have had a serious, debilitating mental illness. 1 in 25 Americans live with a serious mental illness, such as schizophrenia, bipolar disorder, and manic depression. For our topic today, we will focus on mental illnesses. Mental illnesses, also called mental health disorders, refer to a wide range of mental health conditions or disorders that affect your mood, thinking, and behavior. Examples of mental illnesses include depression, anxiety disorders, schizophrenia, eating disorders, and addictive behavior. Many people have mental health concerns from time to time, but a mental health concern becomes a mental illness when ongoing signs and symptoms cause frequent stress and affect your ability to function. A mental illness can make you miserable and can cause problems in your daily life, such as at school or work or in relationships. In most cases, symptoms can be managed with a combination of medication and talk therapy, i.e., psychotherapy. Some early warning signs. Experiencing one or more of the following feelings of behavior can be an early warning sign of a problem. Eating or sleeping too little or too much, pulling away from people and your usual activities, having low or no energy, feeling numb or like nothing matters, having unexplained aches and pains, feeling helpless or hopelessness, smoking, drinking, or using drugs more than usual, feeling unusually confused, forgetful, on edge, anger, upset, worried, or even scared, yelling or fighting with family and friends, experiencing severe mood swings that causes problems in relationships, having persistent thoughts, memories you can't get out of your mind, hearing voices or believing things that are not true, thinking of harming yourself or others, inability to cope with daily problems of stress, trouble understanding and relating to situations and to people, problems with alcohol or drug use, major changes in eating habits, sex drive, excess thirst, hostility or violence, suicidal thinking. Sometimes symptoms of mental health disorders appear as a physical problem, such as stomach pain, back pain, headache, or other unexplained aches and pains. If you have any of these symptoms of mental illnesses, see your primary care or your mental health professional. Most mental illnesses don't remove or improve on their own, and if untreated, a mental illness may get worse over time and cause serious problems. If you have suicidal thoughts, call 911 or your local emergency number immediately. Call your mental health provider. Call a suicide hotline. In the United States, call the National Suicide Number at 1-800-273-TALK or 1-800-273-8255, or use its webcast at suicidepreventionlifeline.org/chat. Seek help from your primary care provider. Reach out to a close friend or loved one. Contact the minister or spiritual leader or someone else in your faith community. Suicidal thinking doesn't get better on its own. Get help. If you or a loved one show signs of mental illnesses, have an open and honest discussion with him or her about your concerns. You may not be able to force someone to get professional help, but you can offer encouragement and support. You can also help your loved one find a qualified mental health professional and make an appointment. You may even be able to accompany them to the appointment. If your loved one has done self-harm or is considering doing so, take the person to the hospital or call emergency help. Some causes of mental illnesses. Mental illnesses in general are thought to be caused by a variety of genetic and emotional factors. However, there is no single cause for mental illnesses. Inherited traits are one of the causes. Mental illness is more common in people who have blood relatives who've had a mental illnesses. Certain genes may increase your risk of developing a mental illness, and your life situation may trigger it. Environmental exposures before birth, exposures to environmental stressors, inflammatory disorders, toxins, alcohol or drug use while in the womb can sometimes link to mental illnesses. What I thought was really interesting was brain chemistries. Neurotransmitters are naturally occurring brain chemistries that carry signals to other parts of our body and our brain. When the neural network involving these chemicals are impaired, the function of nerve receptors and nerve systems change, leading to depression and other emotional disorders. Make sure when you go to your doctor, you ask them to draw all your blood chemistries so that you can find out exactly if your blood chemistries are off balance. There may be specific ones, so look them up or ask your healthcare provider. Some risk factors. Certain risk factors increase your risk of developing mental illnesses, and they include a history of mental illnesses such as a blood relative, a parent, or a sibling, stressful life situation such as financial problems, the death of a loved one, or even marriage, an ongoing chronic medical condition such as diabetes or heart disease or cancer, brain damage as a result of a serious injury, a traumatic brain injury such as a violent blow to the head, traumatic experience such as military combat or assault, and some articles say even racism, use of alcohol and recreational drugs, a childhood history of abuse or neglect, few friends or few healthy relationships, a previous mental illness. Mental illness is common. About 1 in 5 adults have a mental illness in any given year. Mental illness can begin at any age, from childhood through late adult years, but most cases begin in an early life. The effects of mental illness can be temporary or long-lasting. You can also have more than one mental health disorder at the same time. For example, you may have depression and a substance use disorder. Some complications of mental illnesses can lead to disability. Untreated mental illness can cause severe emotional, behavior, and physical health problems. Complicating sometimes lead to mental health disorders include unhappy and decreased enjoyment of life, family conflicts, relational difficulties, social isolation, problems with tobacco, alcohol, and drugs, missed work or school or other problems related to work or school, legal or financial problems, poverty, and even homelessness. Self-harm of self and others, including suicide and homicide, weakened immune system, so your body has a hard time fighting infections, heart disease, and other medical conditions. Some preventive measures. There's no sure way to prevent mental illness. However, if you have a mental illness, taking steps to control stress, to increase your resilience, and to boost self-esteem may help keep your symptoms under control. Follow these steps. Pay attention to warning signs. Work with your doctor or therapist to learn what might trigger your symptoms. Make a plan so that you know what to do if symptoms return. Contact your doctor or therapist if you notice any changes or in symptoms or how you feel. Consider involving family members or friends to watch for signs. Get routine medical care. Don't neglect checkups or skip visits to your primary care provider, especially if you're not feeling well. You may have a new health problem that needs to be treated, or you may be experiencing side effects from medications. Get help when you need it. Mental health conditions can be harder to treat if you wait until symptoms get bad. Long-term maintenance treatment also may help prevent a relapse of symptoms. Take care of yourself. Sufficient sleep, healthy eating, regular physical activity are important. Try to maintain a regular schedule. Talk to your primary care provider if you have trouble sleeping or if you have questions about diet and exercise. Mental health and wellness. Positive mental health allows people to realize their full potential, cope with the stresses of life, work productively, and make meaningful contributions to their community. Ways to maintain a positive mental health includes Getting professional help if you need it. Connect with others. Staying positive. Getting physical activities. Helping others get enough sleep. Developing coping skills. And one article says even take breaks from news stories, including social media. Learn more about the importance of preventing and staying healthy. Learn how to talk about mental health or help others to get help. You can do word search or look on the CDC website, Mayo Clinic website, and also mental health website. I would like to leave you with this thought. When the demand placed on a person exceeds their resources and coping abilities, their mental health could be impacted. For example, if someone is working long hours, caring for a relative, or experiencing economic hardship, they may experience poor mental health. Please follow us on social media at SJBCNC. Thank you. Be blessed.